Thank you, Margaret, and it's healthy to hear what the situation, a very brief overview of the situation in Australia. You've painted a very clear picture. EQIP has, thank you. EQIP has links with other countries in Europe, so we'll, on behalf of some of our European colleagues, I'm going to present some of the issues and the contexts that are going on in other European countries and some of the services that have been set up there. And that will also include Canada, so we'll go to North America in a little while. So on behalf of Karen Rowe, who works in Norway and also works for the Norwegian Medical Association and their Professional Health Institute, which was set up 20 years ago to look at doctors' health issues, I'd like to present and read from her notes on her behalf. After a general survey of doctors' health and well-being in 1993, the Norwegian Medical Association decided to organise and finance several initiatives promoting doctors' health. Several GPs from each county in Norway were recruited and trained to treat doctors and to give them GP services. Here, the doctor seeking help becomes a normal patient with an ordinary medical record, as with other patients, and pays normal fees, as like other patients. In addition, the Norwegian Medical Association recruited a network of supportive colleagues in each county. Doctors can contact these colleagues when they need somebody to talk to, and that could be about high work pressures, a personal crisis, burnout, difficult work conditions, patient complaints, or other issues. As you can see on this photo used to promote this network, the supportive colleagues should be easily accessible and they should meet the doctor seeking help at a collegiate level. They can offer 1 to 3 counselling sessions starting within a day or two, so no long waiting list, helping doctors to sort out a difficult situation, discussing alternatives with them and offering advice. This is not defined as treatment, and there are no medical records kept. The supportive colleagues can also themselves seek out doctors whom they think might be vulnerable and need help. For example, if a doctor has been criticised in the local paper or if they suspect a substance misuse problem. And in Norway they have a resource centre, photograph of it here, which is a low-threshold counselling initiative that can be used by all doctors in Norway who are in need. And here they meet a counselling colleague discussing their situation and their short-term or more long-term needs, and important issues relating to work, their feelings of identity, coping strategies, and the work-home interface are often covered and discussed. Sometimes they will be encouraged to seek further treatment or therapy. Doctors can access this service by just phoning or emailing to ask for a single day's counselling, which lasts for 6 hours from 9 AM to 3 PM, or they can come to a group course programme for 8 doctors per group, which is from Monday morning until Friday afternoon. So it's a 5-day residential service paid for by the Norwegian Medical Association. Many of the doctors who come are exhausted. They have depressive symptoms or they're burnt out, and they often comment that the importance of feeling respected, being in beautiful surroundings and experiencing the generosity and calm of Villasana is important to them. And what is also important is that their medical association has legitimised this as a specific need for doctors. So they have organisational support. During the week-long course there are lectures and group discussions in the living room. Daily physical activity is also important, we're told, both in snow and rain and sunshine. The participants lodge in the villa and the homely surroundings encourage informal group discussions. The kitchen table is used for meals and for long evening conversations about important themes and common themes. Time for self-study, reflection or rest is also important. And this is a BMJ article which gives an example of some of the evidence that doctors who have quite high levels of burnout, depression and anxious symptoms and stress when they come to Villasana are able to benefit from a short intervention, and they can make sustainable changes afterwards. And there are several papers written about this and one of these is this B&J article. Finally, the Norwegian Medical Association also finances a research institute for studies of the medical profession, giving very important longitudinal data on doctors' health and well-being through different healthcare reforms and challenges. Thus, Karen would like you to know that she believes it's important to combine support services for doctors with research, both to evaluate the services and to monitor doctors' health and well-being in general. So I'd like to thank Karen Rowe for contributing to this workshop with her presentation.